So good afternoon, everybody. My name is Carrie Schreier. I'm so glad that you could join us. I'm an extension educator with our Michigan Vaccine Project and our early childhood child development family programming. And I'm going to be your host today for our webinar. We're going to be talking about travel vaccines. And this is a subject that I'm super interested in personally. I grew up with my dad traveling internationally quite frequently and living internationally. And so it's something that I have experience with as well. And I'm excited to invite Dr. Mohamed Satti to join us. And with that, Dr. Satti, I'll let you go ahead and do your introduction, and then we can get going with our questions.
Welcome, everyone. And just a few words about myself. I come from a developing country in Africa, and that country is Sudan. If Sudan, it is south to Egypt. And that one of the main reasons that brought me to global health, as there we suffer a lot from infectious diseases. And I started my career searching as a researcher, and that gave me an opportunity to move a lot around the world, where I had research collaboration in many stations outside the Sudan, where I visited Denmark, Switzerland, WHO, and it is very strange that when I started my career in Sudan, I was linked to Michigan State University here. That was in the last century, the 80s. So that's what brought me to global health.
Fabulous. And Dr. Satti, currently you are a professor in the College of Human Medicine's Division of Public Health at MSU, correct?
It is now the Department of Public Health.
Okay, there you go.
The MOT, Department of Public Health. It has came to a department recently. So that's my main appointment. I have a co-appointment also at the vet school, the microbiology and genetics department. And I also part of the osteopathic online master.
Wow, you have a lot on your
Master of Science in Global Health.
A lot on your plate. We appreciate you taking the time today to join us to talk about this important subject, especially as we're starting to head into holiday seasons and people are starting to think about spring break plans or maybe study abroad. I know I have a daughter who's a freshman or sophomore at Michigan State, and she's looking at her study abroad programs right now for next year. So it's a good time for people to start thinking about global health and what it means to be traveling around our world. So with that, I'm going to start with our first question, because what is global health? Can you talk to us a little bit about global health and how this might be different from, say, our public health environment in Michigan?
Yeah, global health is when you care about all the people. You are caring about the health of the population. It's not about individuals. And this is done in a worldwide context. And this is very important because, as you have seen recently with the COVID, if others are not safe, we are also here not safe. So that is the main idea of global health. So for us to be safe here, you will have to think about the safety of the others. And also global health, it cares about research, studies, and also about achieving equity in health for all people worldwide. That's the goal.
Fabulous. Yeah, we certainly did see through the COVID pandemic that there aren't very firm borders anymore when it comes to the spread of disease and illness. We live in a very interconnected world now. So our next question is about specifically what concerns people might have traveling internationally. And I know this is a very broad question, but what things should people be keeping in mind when they're starting to plan an international trip? What concerns, how do they know where they should be? If they're going somewhere, they should be concerned where there's additional vaccines they need or things they should be aware of?
Of course, it depends on what angle we are looking at it. If we are looking at from a public health point of view, because there are so many things here involved. You may be worrying about losing your passport, but here we are focusing on things that affect the health, like crimes, injuries that can happen disasters, civil unrest, things like that. But on top of that, the most important thing is to think about the medical side of it and get prepared while you are traveling, so that if something happens, then you are prepared and you are ready to handle it. And I think this is the main idea behind our webinar today. When you travel, you are ready to face any consequence, health consequences, or to take precautions and any sort of protection before you start to travel.
Yes, definitely. Yeah, there's so much to think about when you're traveling internationally. I think my audio is lagging. My apologies. I'll try to fix that over here. All right.
Also, I forgot to say that, yes, traveling, it depends on where you are traveling to. It increases the risks for you to get exposed to certain particular types of infectious diseases. And this depends on the geographical location to which you are proceeding or you are, and also the duration of your stay. These are very important, both of them.
Yeah, the destination. So where you're going, of course, is going to make a big difference, whether you're traveling to England or to Sudan or to, I'm trying to think of other examples, right? So that you have that wide variety of places that we might be traveling to that would affect what we might need to get. And then if you brought up the duration as well, which is another interesting point, right? So how long you're staying is going to affect, and I would assume what you're doing too, right? If you're going to a conference and you're going to be staying indoors versus going on a maybe more wilderness adventure where you're going to be outside more.
Exactly.
Yeah. So could you talk a little bit about why we might need special vaccines or special prophylaxis to go overseas?
This is because normally the infectious diseases, they thrive in different climates. So what you have here in the US may be different from the things you have in Latin America or Africa or Asia. And the reason for that, the microorganisms that causing these diseases, they need certain particular environments for them to get transmitted and to infect infect the people. So that's why, and also sometimes the transmission is affected even for example, here, even within US, for example, transmission is affected by the season, the seasonality and the change in the temperature from one season to another. And also because there are agents that are involved in transmission of some infectious diseases that we call them vectors that can live only and become active transmitter of disease under certain particular climate conditions.
So I think, of course, the one that comes to mind for many people when you say that is mosquitoes, right? So we know, especially here in Michigan, everybody's been waiting for that first freeze so that our mosquitoes will go away. But of course, there are many countries where that doesn't happen. We don't have weather that gets cold enough to have all the mosquitoes die off in the winter.
Yeah, and of course, you see here, we have a lot of mosquitoes in Michigan, but their transmission for disease is very specialized. So they are very specific in their transmission. So it's not only all types of mosquitoes that transmit everything. There are, for example, malaria, a parasite of developing countries we see in Africa, is transmitted by certain particular specific species of mosquitoes. So that's fortunately the case here. That's why we don't see a lot of infectious disease transmitted inside the US.
Because we don't have that type of mosquito that would do that.
Because we don't have those species, those type.
Yeah, great. So in that, as we were talking about vaccines, I had said what vaccines are prophylaxis to travel. Can you talk about the difference between maybe a vaccine to travel and then like a prophylaxis or what that would be, what that difference looks like?
So a vaccine, generally, whether you are traveling or not, a vaccine, you take it to prepare yourself or to prepare your body to fight any possible infection in the future. Of course, it has to be specific infection because different vaccines will protect you against specific pathogens or microorganisms. Whereas prophylaxis are drugs and treatments that you take to protect you from certain disease while they are inside your body. I'll give you an example. For example, there is no vaccine for HIV. The HIV is caused by a virus, And so one may start thinking, why not a vaccine for HIV and a vaccine for COVID in one year? Because the HIV virus, the nature of that virus, it changes a lot. So it's very fast changing. That's why they were not able, since 80s until now, they were not able to produce a vaccine against HIV. Fortunately, there are certain particular drugs that if you take them, they reduce the chance of getting the infection, for example, through sexual intercourse by 95%. And for those who are using drugs through injections, it reduces the chance of infection by 75%. Taking that drug.
So yeah,
But
big reduction.
But these are prescribed drugs. You will not just go and take them. They will have to be prescribed by a medically licensed, qualified doctor.
Right. So
and for example, another example for prophylaxis, the one which you take for malaria. If you are traveling to Africa or Latin America, Brazil, some areas like that, you will be worried about getting a malaria, especially for somebody from outside the endemic area. When you get it, you may get it. You may get a severe one. So there are a number of prescribed treatments that if you take, they will protect you as long as you are taking them. It's not like the vaccine that you take and then you'll have to take them, and maybe you'll have to start based on the advice of your doctor, certain particular period of time before you start your travel, taking the prophylaxis. So main difference, again, to summarize, a vaccine is you take to prepare you for future possible infection. But the prophylaxis is a treatment that protects you while you are taking it.
Great. Yeah, that makes a lot of sense. So we get our vaccines are something we're taking that's going to maintain some level of protection without continuing to take them again. Where our prophylaxis, we have to continue to take.
Yeah.
Thinking about that, how soon before somebody plans a trip should they begin to prepare to think about things like vaccines and prophylaxis? How do they know when they should start preparing?
This depends a lot about what type of vaccine we are talking about, and I will give you examples. But for most of the times, international travelers, they will have to start thinking at least 6 or 4 weeks before they start their journey. Why? Because the vaccine takes time to kick in and produce the type of protection that keeps you protected from the infection.
Yeah, that's something I know we've talked about with the COVID vaccine as we think about family gatherings. How soon before something like Thanksgiving should people be considering getting up to date on their vaccines if they're going to be in a group setting again? So that certainly makes sense, that idea that a month, 2 months before we start traveling, we need to be getting those things done. Now,
yes.
I see.
Yeah.
Oh, go ahead.
It's for the COVID vaccine, for example, it's known that now we have to take it 2 weeks before we expect to be protected. That's why during the pandemic, people were advised to be careful until the vaccine and the boosters and these things to kick in. And it takes time for that immunity to start.
So where would somebody go to get these vaccines? They know they're traveling, they're beginning to think about it. They've maybe checked. I see we had a link shared that could have some more information. Where would you go then to get these? Can you just go to CVS like you do for your flu vaccine?
Somebody who's traveling, the first step and the first place to go to is to go to your healthcare provider. That's the first. And I say this why. They may not be able to give you the vaccine you need because they may not have it. But because if somebody has a condition, chronic condition, something like that, they are the one who will decide if it's safe to take that vaccine or not. So you start there, but there are a number of travel vaccine clinics, some of them in Troy, Henry Ford, and Michigan State University. It has a free service for everyone. Some other universities, you have to be an employer. But in Michigan State University, they have a free service that can provide advice for everyone about travel vaccines and what they
do. Lovely. So you don't have to be a student or faculty member to access MSU's vaccine clinic?
No, you can, even for the public, it's open for the population. And the other resources that you can check before even you go to there is the CDC. It gives you idea. Select the area where you are going and see the recommended vaccine and go from there and start there.
Fabulous. Yeah, I see. We had somebody share, Alyssa shared in the chat, a link to the CDC where you can get some more information about where there may be travel advisories, things that you should be looking for, and the travel clinics. I know I had a fabulous experience with the MSU travel clinic. As I shared, my dad lived internationally, and so I was often going to visit him where he was. And before those trips, I would head over to the travel clinic and make sure that I had all the things I needed to have to be traveling internationally. And as a college student, it was nice to be able to access that easily and readily, because had I had to make a lot of steps to do something, I'm not sure I would have done that when I was 21. You don't always put those things at the forefront when you're in college.
Yeah.
So our next question here is about what some of the more common or particularly concerning diseases we might be talking about when we're talking about international travel. Are there a few things that come to the top of your head that we're really watching for?
We have to remember some of these things, which we'll talk about. They have vaccines that protect against them. Some others, they don't have. What I mean by the ones which they don't have, the most common medical condition that you may suffer from in traveling is diarrhea. And diarrhea is linked to food, drinking water. And why is that the case? Because you are not local, you are expatriate when you go to these countries, and you are not like the locals. Maybe they take the same water, they are not affected because they are immune, and you take the same water and you get sick.
Yeah.
So that thing you have to put in mind, and to make sure that you take good food, you take good water. It can be different from the food and the water that the locals take sometimes. And there are some other infections that they have vaccines. And these are two types. Some of them, they are directly transmitted, like the flu, for example. Just make sure that you get the vaccine, the flu vaccine before travel, because that will minimize the chances of reduce the risk a lot. And there is another example that's, for example, called hepatitis A. If you are traveling a virus, if you are traveling to a country, developing countries, because it linked to the hygiene. The way it's transmitted, it is linked to the hygiene. It is transmitted by the house fly.
Okay.
It's a fecal mouse route. So this is transmitted. Some other things like, for example, dengue fever and yellow fever and typhoid fever. And these are all transmitted by vectors, by mosquitoes. And they all have vaccines. And the vaccines of all these is available here in travel clinics, and you can get them, and you can get vaccinated before you leave. The other thing, some of them are required by your destination. But
I didn't even think about that.
But some of them, do you take it for your health, of course. But some of them, some countries you cannot enter without having the certificate that shows you are vaccinated, for example, against yellow fever, for example.
That's really interesting. It hadn't occurred to me, and I don't know why, because we were just having these conversations about COVID and what countries required COVID vaccines to enter. But of course, there are other countries that will have requirements in place to enter, and that wasn't something I'd even thought of. So thank you for giving that reminder that if you're traveling someplace that has a vaccine requirement, this is maybe not just a suggestion. It may be actually a requirement to enter the country, not just a good idea for your own health.
Exactly.
Yeah. Great. Our next question here is about how you can stay safe when you're traveling if you can't afford travel vaccines, or maybe if you didn't have time to get them, some trip came up quickly and you didn't have time to get them. My husband, for instance, does some work. He's an environmental engineer and will travel to where there's some disasters to do work that he might not have time to get vaccines before he heads out. How can you stay safe in those kind of situations?
So, before we talk about that, we remind about what we have just said. Make sure that these vaccines, which you are going to miss, are not required by the country. Required vaccine means you cannot enter the country without having them. But if that's the case and they are not required, you will have to know about what type of possible risks in your destinations. And think about what I talked about, the type of transmission. Try to learn about the type of transmission. Are these diseases transmitted directly from one human to another human, like the flu, for example, or they are transmitted by vectors, agents, like dengue and yellow fever? If they are transmitted by vectors, then there are so many things that you can do. Insect repellents, like, for example, you try to stay away from the areas, bushes and areas which may have the vector. Some of them, they are transmitted by ticks. Try to avoid contact with the vector. Make the area clean. If there is if an area of spread of flies, house flies, they are known to transmit mechanically many of the microorganisms, like the hepatitis A, which we talked about. Hepatitis A, it affects the liver, and it is dangerous. It's not a good disease to get. But at the end, the strong recommendation is to do your best to get the vaccine. The vaccines are a wonderful way to protect yourself and keep you safe. Also, remember to be careful with the water you drink, the food you eat, and the things.
Yeah, I can certainly remember some trips where we had to make sure we were drinking out of bottled water with sealed caps, and to ask for things like, I'm sitting here with ice water, right? And I think sometimes we forget that ice is water, which is then made from common sources. So I know that there were times when I was traveling where we had to be sure to ask for no ice in our drinks and use bottled water only, or even things like fountain beverages like soda or pop are made with water. So sometimes you really have to be thinking there about what you're consuming. Great. So our next question we touched base on a little bit, and that was, how far in advance do you need to get travel vaccines? I know you shared you should start thinking about it 4 to 6 weeks or so before travel, or you should be getting them. Are there any that are particularly longer, or anything we should be thinking about there?
If, for example, if we think about malaria vaccine, which is it's not available here in the US. The malaria vaccine is not available. And
not at all.
And WHO recommends it now for kids, for children. And the reason for that, I got it, I gave it as example because I want to show you the doses that you take before you get protected. So the reason for that, it is for children because they are at highest risk of developing severe disease and die of malaria. So that's why now, but it works for adults. Now it's recommended but even for your kids, if you are traveling to malaria area, they cannot get it here. They may get it when you arrive if you are going to stay for longer period of time. If not, then you will stick to the prophylaxis we talked about. So let's talk about how these are 4 doses. It's a new vaccine, and you take 1 dose every month, and the last dose after 9 months. So think about how long it takes until you finish all that. You will get partially protected as you are. When you get to the dose number 3, you are 75% protected. 66%. When you get to the full dose, 4 doses, you are percent protected.
Yeah, so that would only be if you were like relocating to that country, or
you are
spending a year or whatever there.
Exactly. Yeah.
Gotcha. That I understand this. Again, going back to my personal experiences, I know my dad, as somebody who was relocating and living in the countries he was going to, had a different set of vaccines and different recommendations than I did when I was coming to visit for a week or 2 around my college schedule. So that makes sense. If you're the one who's living there, you're going to need to have some different concerns. So our next question is also something that we have touched base on a little bit here, but it's about requirements of vaccines. So does every country require the same vaccines? You've already said no to that one. So we know that not every country is going to require the same vaccines. Why is there a variance there? Why might we have some required in some countries and not in others?
Because some countries, they have active transmission, and some other countries, they don't have active transmission for that particular disease. So for example, again, the yellow fever, why is it only certain countries, Sudan, Africa, and some Latin American countries, they require you to show vaccination against yellow fever because there is an active transmission there. But you may go to a country where there is no transmission. There is no need for that vaccine there.
Right. So we're not worried about yellow fever here in America because in Michigan or in the United States, because we don't have that here, right? We don't need to worry about that in the United States. Great. Our next question is about malaria, and you've mentioned malaria. We've heard about it several times already, and I know it's one that certainly comes to people's mind when they're thinking about travel is malaria. Can you tell us what that is and why we might hear so much about it?
And just before I go to the malaria, I want to remind the people of one vaccine which is very important, which is the meningococcal meningitis. This is caused by certain particular bacteria, and then we will go to the malaria. And why I remember this, because it causes 50% for mortality.
Wow.
It kills in 50% of the infected people. And this is a very effective vaccine. So remember, if you are traveling, especially important if you are going to be in crowded areas and these things, and it has a direct transmission, it's not transmitted through vector, something like that, from person to person.
Wow, that's 50%. That's certainly high.
Yeah. And your other question is about can you repeat the question, please?
Sure. Yeah. Just about malaria. If you could tell us more about what malaria is and why we hear so much about malaria.
Yeah, malaria is a parasite. If we know, it's a microorganism that is a very small, microscopic, single cell. And it lives under certain particular climate conditions, and it is transmitted through certain particular mosquito species. So malaria is very common in developing countries, and it can cause severe and fatal consequences, especially in children and pregnant ladies. And until very recently, malaria had no vaccine. And especially for people who are not living in the endemic areas, if they get it, it is going to be, it's dangerous. It's not a pleasant thing to get. So that's why we'll have to be prepared with the prophylaxis before we start traveling to those areas with active air transmission. It used to be here in the US.
It was here in the US?
It was. There was a transmission here in the US at the beginning of I think in the middle of the last, I think it was eliminated completely by the 40s of last century.
Okay.
Yeah.
So it's been 80 years or so since we've had it here in the United States. But I would assume, and although this question is further down, but this feels like a relevant question here, I would assume that as our temperatures are changing and as communities are maybe no longer having winter-like temperatures and getting so cold in the winter, that we may see a change in where some of these illnesses are found.
If people are not very careful about it, malaria transmission can get reestablished here in the US, especially with the refugees movement and the easy movement between the different countries and continents. Yes. What makes it a little bit not easy to re-enter, because it requires certain particular mosquito vector species to get transmitted. That is a good side of making it under control. The bad side of that, it is very difficult as a disease to get eliminated or eradicated. But because US they had the capabilities, they were able to do it. Why? Because you cannot eliminate the mosquitoes. Not easy. So whenever you have a vector involved, an agent involved in transmission, it's not easy to get rid of that particular disease.
I hadn't thought about that either. So when we're talking about something like COVID that spreads from person to person, when we talk about eliminating the spread, we're just talking about eliminating that virus. Where when we're talking about something like malaria, we now have this mosquito entered into the situation. So it's not just about eliminating the virus. There's also this mosquito that we have to deal with, and they're hard to eliminate, as we all know about any kind of mosquito. They're hard to eliminate.
And also, it is very important because there was no vaccine until very recently. And we'll talk about the vaccine, and then it can cause dangerous consequences. It can result in renal failure, it can result in mortality, both mortality and morbidity. So I want to talk about morbidity, the effect on the body, that is the pathogenesis. And we'll talk about the fatality, the mortality, the death rate. Both of them are high, especially in infected kids and pregnant ladies.
Speaking of that new malaria vaccine, can you talk a little bit about that? We had one of our questions about that new, just give us some more information about the malaria vaccine.
The malaria vaccine, which is just approved very recently, is called the R21 vaccine. How it works, everyone here knows now about the COVID vaccines. So the malaria vaccine, when it's given to the child or to the adult, they prepare their body with antibodies. Those are agents that will fight the infection. So when you get the vaccine, you get a protein from the parasite itself in your body. That will enable your body to produce fighting agents against future infection. So you produce something called antibodies. And these antibodies, when you get the malaria organism, they will go and attack and block it from entering the red blood cells where it lives in the body. And that's how it protects. And it's a very good vaccine. It has the people that have been trying to produce a vaccine against malaria for hundreds of years. This was established just a few years ago. I think last year it was the approval, 2022. And as I said before, until now, it is recommended and by the WHO for, and this is not because it doesn't work for adults, but because they are in more need for the vaccine than the adults. And it's the vaccine, the dose, it's 4 doses. The dose costs about $2. So it's cheaper than the treatment even.
Yeah, so it's a cost-effective vaccine as well. It's not something that's cost prohibitive. That's good to know. All right, our next question here is about staying healthy while we're traveling. So you've given us some tips about thinking about things like the water we're consuming, the food we're eating while we're traveling. Do you have any other tips about things we should be keeping in mind while we're traveling?
For example, think about the infections which are directly transmitted. Get the flu shot, for example. Avoid germs. How? Most of the germs, they are transmitted by germs, the microorganisms, viruses or bacteria. They are transmitted most of the time through the things which we touch. So put that in mind. When you think about the transmission, how the disease is transmitted, you will have idea about how to protect yourself. So think about the risks and the transmission of the disease in that area, and then think about how you are going to prevent yourself. Stay hydrated and get enough sleep. What is the relationship between this and protection? Because it gives you a booster for the immune system. It makes your immune system healthy and active enough to protect you. Eating healthy, all these things, they will help to keep the immune system at its best level. Remember, traveling itself, it has stresses. And when we are stressed, that will cause some suppression in our immune response.
Yeah, it's interesting. We don't give that enough credit, right? How being worn down can cause us to get sick. And when we're traveling and we're on a different time schedule and we're not sleeping, when we're eating different food, I hadn't even thought about the fact that you're more likely to get sick just in those circumstances. Yeah. I know my sister had a huge issue with heat exhaustion once when she was traveling. And it was just like you said, staying hydrated. She hadn't slept. She didn't have enough water to drink. There wasn't water where she was going, which is also something I think we tend to take for granted here in the United States, that wherever I'm going to be able to find safe water to drink. And I know in the situation she was in, she couldn't find safe water where she was going. We need to be mindful about that too, right? What were
definitely
the differences that we might see in different countries. So if you do get sick when you're traveling, what should you do? How do you find a hospital or somewhere to go? Do we need to worry about health insurance? Do you have any tips for people when they're...
Some of These things starts before you go. If you are going to stay for a longer period of time, of course, your host there can provide you some tips or where to go in. But before that, you'll have to take numbers from you, with you from here. There are certain particular offices in the CDC, Washington, that can help travelers if they get sick while traveling.
Okay.
And other than that, you can definitely contact the nearest US embassy. They are very helpful. They will have list of all the possible, based on the condition, facilities that can help your situation.
Sure.
Yeah.
It didn't even occur to me to think to turn to the US Embassy to get a list of providers, but that makes a lot of sense, right? You go to the embassy to get that information about where you can access.
And remember, because you need it, because sometimes you are not going to stay for a long period of time. You don't have a host. You are going for tourism, for example. You are visiting for a short period of time. Yeah. But if you are going for a long period of time, of course, you will have to do more than that. And you'll have to ask about the coverage also, your insurance coverage. And if it covers you out overseas, most of the time, yes, it covers. But you'll have to make those arrangements before you start.
Yes, you have those plans when you're there for a longer period of time. Our next question here is about COVID specifically, and we've touched base a little bit on COVID as we've been chatting here, but could you talk a little bit about how COVID spread so quickly around the world? I just was at a meeting the other day and we were talking about how when everything shut down here in Michigan, I think we had one identified case of COVID and suddenly we found it everywhere, right? So how did it travel so fast around the world?
Viruses, they have their ways of changing genetically. And COVID, the coronavirus, it has a protein on the surface that enables them to interact with the human receptors in the cells efficiently. So it's very easy for them to establish an infection. For a virus to establish an infection, it has to enter inside the cells of your body. Why COVID it can spread easier than other type of viruses? It's one of the reasons is a type of protein that they have on their surface, the virus. It has the perfect receptor on the body of the host through which they can enter inside the cell to start their circle.
Okay.
That's why the vaccine that we have targets those proteins and prevent the virus from entering. It keeps the virus outside the cell. Virus outside the cell is like nothing. It cannot do anything.
Sure. It's like having the door closed when it's cold outside, right? It keeps the heat in and the cold out.
Yeah.
Yeah. Have we seen global pandemics like this before COVID?
There was one very recently. You remember the swine flu?
Yes. Yep.
2009. And one thing you may have heard about is the influenza pandemic 1918.
Yes. Yep.
That pandemic wiped 30 to 33% of the world population. It was
such an unbelievably high number.
Yes, and we were very lucky with the technology and advance and the vaccines that we had in 1 year. And people, this was a blessing because that was very helpful. Otherwise, it could have caused a lot of more fatalities for the COVID itself. So there are many, but the most known ones recently, the one in 1918 and the 2009, the swine flu.
And I would imagine that given the difference in international travel, we saw the COVID-19 pandemic spread around the globe perhaps more quickly than the Spanish flu did in 1918, or was that not the case because that traveled more rapidly? Do you know? Sorry if
the COVID, the 1918 one caused more fatalities, more mortalities, because that time the infrastructure and the technology was not as advanced as now.
Sure.
But yes, the COVID spread faster because of no borders thing now. Even that time, the travel was a problem. But these days, the travel between countries and continents are much easier. But so there is a balance here. Technology versus open borders And so this affected the spread. The COVID spread faster, but the technology was better, much better.
Yeah.
That one was spreading slower, but the technology and the infrastructure and the healthcare was much lower than now. That's why it wiped 33% of the people. And that time, although that time the population was not as much as now, for example.
A third of the population is so many people. And it's interesting to think about that balance that you're talking about, that difference between how rapidly something spreads and where we have the infrastructure and support to provide appropriate medical care, to all pool our resources globally to create a vaccine, all of the things that went into helping to curb COVID as quickly as we were able to do. Great. Well, our next question here is about somebody who's applied to the Peace Corps. And she shares that she's a little concerned about how many vaccines it's recommended for her to get. And the question specifically here is, if there's more vaccines required to visit that country, does it mean that it's less safe? Do you have any thoughts about somebody having to get a lot of vaccines before they travel? Should they? I can see that would be surprising to someone.
If I can rephrase this question by saying, is it okay to take multiple vaccines at the same time, for example? Because it is much when you take the vaccines, the place becomes safer. But some people may think, oh, if I'm going to that country and they require me to take five vaccines, and this is going to enter my body and it's going to cause me trouble. And multiple vaccines, they don't overwhelm the immune system. It's known and well studied, even for babies. If you give them the same day or a par or boosters, they don't overwhelm the immune system. So the way to go here is you don't change plans because there are more vaccines needed for that particular country. You just make sure that you take what is recommended and what is required.
I think that's such a good reminder. And it's certainly something that we've talked about on a lot of these webinars, that we can handle having multiple vaccines at a time. Our body is exposed to a lot of things throughout our life, and we're good at handling those things. So we don't need to be worried about having more vaccines than less, perhaps. Great. So if somebody does travel internationally and they come back and then find out that they're sick, is there something that they need to do differently, or some thoughts they need to take into account if they've been on an international vacation and now they come back to the United States and they're ill?
You want to immediately go to your health care provider, but it's not only that. You'll have to give them very detailed picture about where you are coming from, because otherwise they will not expect that you are having something that is coming from outside the US. And it's very important that they look and connect things to where you have visited to direct you to appropriate places, because sometimes you may get an infection which they cannot diagnose in that particular healthcare place. So they will, for example, ask you to go to the infectious disease clinic, and there they will have the proper way to deal with the. And we had a situation I remember when I was student in University of Khartoum. We had a professor from Germany. He came and he went with us to East Sudan, where there is a very high transmission of a disease called leishmania. It's like malaria, transmitted by a fly, a vector called sandfly. By the way, some types are present here in the US, some type of the fly. So the man got the infection, it takes time to appear. And he went back to Germany. He almost died because they were diagnosing for wrong things until he got his digestive tract perforated. At the very last end, they discovered that it was from Sudan, who visited some time ago, and gave him the treatment, and he recovered.
Wow. Yeah.
It's very important. The history is very important, and you have to be detailed.
We went through this personally. My dad came back from living in China for a while and was sick. And it took them quite a while to figure out what was going on, in part because they just simply, like you said, weren't looking for those sorts of things. He was a man from Michigan who lived here, and it took a while for them to figure out what was going on. And yeah. So we just have time for a couple more questions. And I'm looking through our list here. I want to make sure we get all of our important topics covered. The next question is about traveling internationally with children. And they're asking if there's different vaccines that children may need to travel than adults. And I know you've mentioned like the malaria vaccine, for instance, is recommended for children and not for adults, but that's not available in the US yet. Are there any differences you might be looking at there if you're traveling internationally with children?
I don't know of any vaccine that is specifically required for kids when they are traveling and not for the adults. They are all about the same. And depending on the age, that will determine if the child or the infant can receive that particular vaccine. That they will decide. Because if, for example, nurse feeding an infant, they may not give them the vaccine for one reason. If the mother takes the vaccine, they will pass the protection. And the other reason, if you give the vaccine, the kid will not benefit from it because they have not fully developed their immune system fully yet. If you don't have a fully developed immune system, the vaccine will not work. Or if you have passive immunity passing from the mother while she's nursing, that will interfere with vaccination. So these are the things but there are no specific vaccines which are required for kids and not for adults or vice versa for traveling.
Okay, great. On that kind of same trend of thinking about our health and our children when we're traveling, if you currently have a health condition of some kind, should you be more concerned about traveling? Or what concerns might you need to take into mind if you're traveling?
You will have to think about, first, you have to consult with your healthcare provider, check with them what type of vaccines you need to take. Most of the time, there is no contradiction, but they are the one who will decide if you are fit, if it's an immunological condition. If somebody is immunosuppressed, then they will have to advise you what to do because the vaccine is not going to work. So that's the thing which you can, if you have immune diseases, that is when the vaccines might not be prescribed, or if you are allergic to vaccines, if you have hypersensitivity. So if you cannot take the vaccine. So in that case, they will, based on the type of transmission of the disease, they will give you an advice.
Yeah. And then of course, certainly, and this is a broad question, but I know there are other health conditions. For instance, if you receive something like dialysis, or if you have some sort of bigger medical condition that you would need to take into account before you make that decision to travel, obviously.
Yeah.
Let's see, we've got just a couple more questions here. Our next question is going back to COVID. Do people still have to test for COVID before they travel internationally? Are there still those requirements to test and show vaccines and stuff like that in some countries?
If you are talking about US, they don't require any proof of vaccination against COVID if you are going out or in. Some other countries, I don't know currently now, at this moment, of any country that requires a certificate for COVID vaccination. However, put in mind, it changes based on the level of transmission and what is going on from time to time. So recommendations and requirements, they change.
That is such a good reminder, and certainly something we've all seen with COVID, right? The recommendations and the rules are changing so rapidly. It can be challenging to stay up to date on what we're supposed to be doing or what we have to do before we can travel. I know too, as they were making those regulations, it was challenging sometimes for people to figure out how to get a test, for instance, and get results back in 24 hours or whatever those requirements might be. So yeah, certainly paying attention and staying on top as we head especially into this fall season where we expect to see an increase in COVID and flu numbers. So we've got, I think, two more questions. One is our second to last question is any recommendations you might have that you haven't shared already to prevent people from getting ill when they travel? Things we touched base a little bit on travelers' diarrhea, some of those sorts of things. Are there any particular recommendations to help keep people healthy and while they're traveling?
It is the same thing we talked about. Make sure that you stay dehydrated, food, the water you drink, and take all the recommended and required vaccination based on your destination. Take more care about the personal hygiene. As I said before, most of these pathogens are transmitted through touches. You touch contaminated areas, and think about where you are. Avoid dusty areas and crowded areas. That will all try to be, if it's crowded, try to be in well-ventilated areas. That will reduce the transmission of the disease. But the specifics here, they will differ based on what type of transmission and what type of risk you are going to face. And remember to get prepared by knowing whom to contact, and get ready and have those contact lists even before anything happens.
Yeah, being prepared is so important. We very much appreciate your time today. I'd like to offer you the opportunity. If you have anything else you'd like to share that you haven't had a chance to share yet, please, feel free. We'd love to hear any other tips or information you have to share regarding health and safety before we head out.
Yeah, just a reminder, one last thing. We always talk about traveling internationally. What about traveling locally inside the US? Do you need to do anything? The one thing that you need to do, you need to make sure that you are up to date in your vaccination schedule. The regular vaccines, there is no here specific recommended vaccines for traveling inside the US. And why I say that? You are living here and you have missed a vaccine. Why do you want to care more when you are traveling? Because travel itself, it puts stresses on you and it lowers your immune system. So when you are more ready to fight anything that can happen, that is more needed while you are traveling. You prepare your immune system and help the immune system to get at the healthy level while you are traveling, to avoid suppression due to stresses and other things.
Such a fabulous reminder to end our webinar on today. Make sure you're taking care of your health and your wellness before you start to head out to travel anywhere, whether it's within the United States or outside the United States, staying up to date on our vaccines and trying to get enough sleep and drinking enough water and all those important things we do that help us stay healthy and well in our daily lives become so much more important when we're traveling, not just because we don't want to have some major illness, but it's not fun to be sick on vacation or when you're traveling. You spend a lot of time and money to prepare for those vacations, and you want to be able to go and enjoy yourself and not be sick while you're on your vacation. Thank you so much for joining us today, Dr. Satti. I so greatly appreciate your time and expertise in this area. There's been a lot of really unique and interesting information that you've had to share today, and I appreciate that very much. I would like to draw our participants' attention to the chat box. There is a link shared there for an evaluation today. We appreciate your taking the time to complete that. And thank everyone for joining us today. And I hope you have a wonderful rest of your day this Tuesday. And with that, have a great afternoon. Thank you.